Hi, I'm Lauren Stanford, and I'm going to be doing the negative pressure wound therapy dressing demonstration video. So negative pressure wound therapy, or NPWT, is used for stage 3 to stage 4 ulcers, and according to Song et al., it both reduces the time it takes for a wound to heal and results in more success in completing healing the ulcer itself. So the first thing that we want to do to start the NPWT is we want to verify that we do actually have an order for this. Once we verify the order, we can go into our patient's room and cleanse our hands and put on our gloves and verify the patient's name and their date of birth to make sure they are the correct person that we're doing this on. Once we do that, we can go ahead and remove the old dressing. If this were a negative pressure dressing already, we would want to make sure that the suction is off before we start removing that dressing, because we don't want to try to remove that when the suction is on. Once we remove the dressing, we can go ahead and cleanse it per protocol. Usually my protocol is to cleanse with saline and then to dry with gauze. We also want to make sure the area outside the wound itself is dry, because we want to be able to adhere that dressing to it. So once we've done that, we can go ahead and discard our gloves, wash our hands one more time, and get our supplies together for the NPWT. We want to go ahead and clean the area that we're going to put these supplies on, because we always want to start on a dry and clean area. Once we clean the area, I'm just going to go ahead and wash my hands one more time, and we're going to put on new gloves. So now that our gloves are on, we can start with our first step, which is our skin prep. We're going to want to go 1 to 2 inches outside of the wound, all the way up to the base of the wound itself. And this is just to help protect the skin and prepare the skin. Once we've done that, we can go ahead and take our drape, which is an 8 by 10 piece. You're gonna have to fold it in half and cut strips out of it. They're usually 1 to 2 inch strips. They're gonna end up looking something like this. And we're gonna use those pieces of drape to help protect the skin around. So I'm just gonna use regular tape so you can see what I'm doing. But we're actually gonna go all the way around this wound, up to the base of the wound, and put pieces to protect that skin. Once we've completed the whole area around the wound, we can go on to our foam. Now, Perpenite et al. Black polyurethane ether is the foam that is most commonly used, but there are other types, and this is going to be per manufacturer order. So I have my foam here. We're gonna end up cutting this to fit over the wound itself. So we can kind of size it up and start cutting until you end up with a circle that's gonna fit the wound itself. It should fit over the entire base of the wound because we protected the skin around it. If it overlaps a little bit, that's okay. If we didn't protect the skin around it, we wouldn't want to apply suction to any area around the wound, because that suction is not good for the already healthy skin. We also want to make sure that it does cover the entire base of the wound, because if we don't cover the entire base of the wound, those parts are not going to benefit from the therapy itself. So now that we have our foam, you never want to press down on this because it's going to cause pain to the patient. So you're just going to want to hold it in place and take your drape and put the foam in place, sealing around the edges with your finger. Now we can go back to our large piece of drape and cut another about 4 by 4 piece for this. It's going to end up looking like this, and it's going to seal it over the top. Again, we're going to use our finger to go around, not pushing on the foam itself. To add this port on top, we're going to have to pinch up the middle and actually cut about a dime size hole. I don't know if you can see the hole in this, but there is a hole here that the port is going to fit around. So now that we have that sealed and it's taped on, we're going to take our port and we're going to line up the hole that is underneath this port and the hole that is on the drape itself. So now that that is lined up, we can start sealing with our fingers around the edges. And we're gonna take our cord. There's gonna be a clamp here. You wanna make sure that it is unclamped. There's also gonna be a clamp on the system that is connected to the wall. That clamp needs to be unclamped as well. The two ends are actually going to twist together, so you're going to want to twist them together and then turn the machine on. Once you turn the machine on, it's going to start suctioning. It's going to actually suction down, and you're going to want to listen for any air leaks at that time. You can hear these with your ears, you can feel them with your fingers, or you can listen with your stethoscope. If you were to notice an air leak, you're just going to want to take another piece of drape and place it to help seal that air leak. There are some documentation things that I want to mention. You need to document the type of filler that's used, the amount of suction, whether it's continuous, intermediate, whatever, the appearance of the wound, the drainage, etc., how the patient tolerated the procedure. Did they tolerate it well? Was it abnormally painful for them? You want to document the number of pieces or foam or filler that was used. And then you want to write on top the number of pieces of foam or filler that was used on the actual dressing itself, so the next person will know. And then, of course, any education that you gave to the patient or the family. For more information, you can visit National Wound Care's YouTube page. They actually have an MPWT training video. That was my main source for this video itself. So if you have any information, visit their page. And that pretty much concludes this demonstration video. Thank you.